What are the long-term outcomes for homeless people with schizophrenia? Have you ever wondered what happens to individuals experiencing both homelessness and schizophrenia over time? The long-term outcomes for these individuals are often quite challenging and can significantly impact their health and overall quality of life. Schizophrenia is a serious mental disorder that includes symptoms like hallucinations and delusions. When combined with homelessness, it creates a cycle of difficulties that can be hard to break. One major concern is the increased risk of psychiatric hospital readmission. Studies indicate that homeless individuals with schizophrenia are nearly 30 times more likely to be readmitted to psychiatric hospitals within just 15 days of discharge compared to those who have stable housing. This highlights how difficult it is to stick with treatment when there is no stable place to call home. Additionally, there are higher rates of co-occurring disorders among this group. Many face other medical conditions, substance use issues, and additional psychiatric illnesses. Sadly, this population is also at a greater risk of premature death from various causes, including suicide and untreated physical health problems. The lack of stable housing makes it even harder to access necessary medical care, which only worsens these outcomes. Another serious issue is the increased vulnerability to crime and victimization. Homeless individuals with schizophrenia often find themselves at a higher risk of being victims of crime. Men with psychosis may face threats and assaults, while women are particularly vulnerable to sexual violence. This not only adds to their emotional trauma but also destabilizes their already precarious living situations. Chronic homelessness is another long-term outcome that many individuals with schizophrenia experience. This means they go through continuous or repeated episodes of homelessness over extended periods. Such a situation often leads to ongoing mental health challenges, difficulty finding employment, and social isolation, which can perpetuate their homelessness. Employment and economic stability are also major hurdles. Schizophrenia is linked to high unemployment rates, especially among those who are homeless. Without stable housing and adequate treatment, it becomes extremely difficult to maintain a job, limiting their income and access to resources needed for recovery. Access to treatment and support services is often limited for homeless individuals with schizophrenia. This lack of consistent access to psychiatric care and medication can lead to poor management of their symptoms, increasing the risk of relapse and hospitalization. To improve these long-term outcomes, integrated approaches are essential. Programs that combine housing support with mental health treatment and social services have shown promise. Providing stable housing along with comprehensive psychiatric care can help reduce hospital readmissions, improve health, and support social reintegration. Overall, homelessness severely worsens the long-term outlook for people with schizophrenia. Addressing these challenges requires coordinated efforts to provide stable housing and ongoing mental health support tailored to their unique needs.